When the behavioral health crisis first occurred, there were a lot of youth and families whose services were just cut off. It broke a lot of the trust that people had in the system, specifically in the behavioral health system, and that it's going to take a long time to rebuild that.
The system's design is what's causing the problems for everyone else. The staff who work in it and the decision makers, as well as the people who are served by it. So if it's a crisis that we're all impacted by.
Centennial Care was supposed to be an integrated system, so somebody could walk in the door and have their health care needs assessed regardless of where they are. But it doesn't work that way. It's still behavioral health and physical health, and they're still not talking to one another.
We often just incarcerate young people, and LGBTQ young people are often most vulnerable because they are maybe facing unsafe situations at home, so that leads them to the streets.
One of my clients that called, she was so happy that I could give her an appointment. She's Medicare, she's elderly, and she said I was the 17th person that she called and she got refused 16 times for an appointment.
The demand for healthcare services is far greater than the supply of healthcare providers and personnel.
It was kind of hard to be able to find somebody that I was comfortable with, and for somebody that actually respected me and didn't contradict what I say. So it kind of took a couple months before I was able to receive any services at all.
We know when youth and families and communities thrive, that all of our communities do better. And so I think that we need to really have long-term investment in the behavioral health system.
For there to be more recreation centers or more youth programs that have people that'll actually sit there and listen to them instead of right away just giving them access to drugs and not even coping with the feeling whatsoever.
The Legislative Finance Committee has drilled down several times now, letting the legislature know about how poorly run this program is.
Funding's always a barrier. I think good policy needs to be made, and there needs to be some solid agreement and direction at the legislative level.
A message I have for Health and Human Services regarding the behavioral health crisis in New Mexico is to take a look into who you're having counsel these people, because some of them just need a little more experience, and also prescribing drugs really quickly isn't always the good thing. People do need to work through a lot of issues.
We need to open the doors to more practitioners able to be endorsed by Medicare and Medicaid.
We need to have more clinicians. That's both an economic development opportunity in our state. It speaks to developing the workforce, and it also speaks to having an educational pipeline that creates those opportunities.